Good morning, friends. Welcome back to my YouTube channel, Medical Class. In the playlist, I have provided almost all the topics in a very systematic order, and you can make use of it. Now, my dear friends, today we will start with particular disorders. Okay, we have got different disorders of muscular dystrophy. Different types are there. DMD is the most common type. BMD is also the most common type. Apart from that, limb girdle muscular dystrophies are there, myotonic dystrophies are there, emerald refuse type is there, and many other types, congenital myopathies are there. So today onwards, we will go into deal with all these muscular dystrophies one by one. To start with, we will start with myotonic muscular dystrophy. Myotonic muscular dystrophy. This myotonic muscular dystrophy is also called as Turner's disease. Okay, so I think yes is silent. Okay, Turner disease. Now, myotonic dystrophy is one kind of muscular dystrophy which is actually seen in the adult form. This is not the juvenile form of muscular dystrophy. Myotonic muscular dystrophy is most commonly seen in adults. Okay, so why it is important in the childhood practice, that also we will see. They are the group of conditions with the nature of progressive muscle degeneration. In myotonic muscular dystrophy, also we find there is progressive muscle degeneration leading to muscle weakness. Okay, now this is the most common adult type, and it not only affects the muscle but also the other systems. This is a very important differentiating point. In other muscular dystrophies like DMD and all, there is only involvement of the muscle. But in case of myotonic muscular dystrophy, along with the muscle degeneration, you will also have involvement of the other body systems. For example, there may be mental retardation, there may be cardiovascular problems, etc. Okay, one of the major things why it is called as myotonic, because myotonia is a major manifestation here. Myotonia means nothing but myotonia means sustained contraction of the muscles. Okay, so myotonia comes from the word myo, which means the muscle, and tonia, which means the sustained state of a contraction. Now, dystrophy means, as we know, it is a degeneration and shrinkage of the muscles, and there will be delay in relaxation of the muscle. That means if ask the patient to open the fist, after closing it, when you say to open the fist, he will have delayed relaxation of the muscles and he will have difficulties in opening the fist or fist. Okay, so hence the myotonic in this particular muscular dystrophy, we will have a lot of problem for relaxation. That means muscle remain in the state of contraction for a longer time. Now, myotonic dystrophy is considered as the second most common muscular dystrophy. Okay, it can be seen in children also, but most commonly this is seen in adulthood. And here, most commonly this is seen in the Northern American part, Europe, Australia. And if you look into the incidence, it is 1 in 30,000. And what is the pathology? It is an autosomal dominant trait. Autosomal dominant trait means it can be seen in both male and female. Okay, and dominant means it will not skip the generation. In each generation, we will have this particular problem. Another important thing is this is a condition with the multiple organ systems are get involved. Not only one system like muscle, along with the muscle, many other systems will also get involved. What are the other functions that may be involved? Like muscles, smooth muscles, cardiac muscles, cardiac functions, GAT, then uterus, the muscles involved there. So they all get involved. And sometimes, interestingly, there will be intellectual impairment. See, in normal muscular dystrophies in children, there is no mental retardation, intellectual problems. Child will be absolutely okay cognition-wise. But here, the dystrophy-like symptoms will be there, but child is also having mental retardation. And these babies looks normal at the time of the birth, but sometimes facial weakness can be seen if you observe very keenly. Spot diagnosis of this is an inverted V-shaped upper lip is characteristic. Now, if you can diagnose this patient on the spot by looking at the patient, because In the lip area, he will have inverted V shape. Okay, inverted V shape appearance in the lip area because that muscles are stretched, myotonic, isn't it? So muscles are get stretched. Therefore, this orbicularis muscles, etc., facial muscles. So because of this sustained contraction, so they form an inverted V-like structure, which is almost on a spot diagnosis in this particular case. There will be progressive weakness of the distal muscles, okay, particularly the intrinsic muscles like thenar and hypothenar. Now, see, proximal muscle involvement is very common in muscular dystrophies, but this is one condition where distal muscle weakness can be seen, especially the muscles which are seen undergoing the dystrophy are distal muscles like thenar and hypothenar muscles. Okay, and the thenar and hypothenar area also looks very flat. Okay, so two important things: multiple organs are affected here, systems are affected, inverted V shape is there. Then distal involvement is more than the proximal muscle involvement, especially the distal most muscles of the thenar and hypothenar area. So coming to the other part of this muscular dystrophy, myotonic muscular dystrophy, there are two different types of myotonic dystrophy. Now this is very important for us. Why we are discussing this myotonic muscular dystrophy in the pediatric practice for this purpose? What is that? There are two presentations there. One is type 1, another one is type 2. It is also called as type 1 DM, type 2 DM. Here DM means not diabetes mellitus, DM means dystrophic myotonic. Okay, DM1, dystrophic myotonic. What is DM1? This is the congenital onset. Okay, if it is congenital onset means definitely can be seen in children. So this is congenital onset. By birth itself the problem will be there, and in the infancy also this can be identified. Okay, this disease is first time explained by Sternert in 1909. Okay, and in 1992 the mutation is discovered on DMPK gene of the chromosome number 19. Okay, so autosome chromosome number 19, dystrophic myotonic protein kinase gene. DMPK means dystrophic myotonic protein kinase gene. So this was identified in 1992. However, in 1909, first time Sternert described this particular disease. So this is congenital one. This can be seen in birth. This can be seen at newborn. This can be seen in the infantile period. What is type 2? DM type 2. This is less common, and this is of not childhood onset. The first one is very important for us because that can create confusion with other types of muscular dystrophies like DMD and all. So this is not childhood onset. Predominantly, this is proximal myotonic dystrophy. This is an important point. See, type 2, which is not common in children, which is very common in adults. So there, the proximal muscle involvement is more. The type 1, which is more common in children, congenital onset, the distal muscle involvement with the thenar muscle and hypothenar muscle is more. Okay. Again, for this type 2, the gene which is responsible is the ZF9 gene. Okay. So chromosome number 3 is involved. See, for the type 1, autosomal number 19 is involved, but for the type 2, the autosome number 3 is involved. There are so many subtypes. Okay, even in the myotonic dystrophy also we have got so many subtypes, congenital and juvenile. Now congenital, child is born with the severe weakness and skeletal muscle abnormalities. At the time of the birth itself, child will have severe weakness and skeletal muscle weakness. And baby is floppy at birth with difficulty in breathing and also feeding. And delayed milestones are there, and intellectual disabilities will be there. Another onset of type 1. Okay, type 1 is congenital onset. Again, it has two subtypes. One is congenital and another is juvenile. The juvenile onset is a child may be noticed with the limb difficulties and the weakness of the limbs with the face affecting the speech. Okay. See, these are actually different set of disorders, but it can create confusion with the muscular dystrophies. And dystrophic gene is also responsible here. Therefore, the name is also myotonic dystrophy. Now, to short, myotonic dystrophy is of two types, type 1 and type 2. In the type 1, again, we have got some subdivisions like congenital cause, so congenital variety and a juvenile variety. Now coming to the adult onset, this is considered as a classical form. Adult onset is considered as a classical form. This usually start at the teenage years up to 30 years. And there will be myotonia with the finger weakness and handwriting, etc. Usually the child will have, not child, the adult will have the problem with the handwriting and all, which is evolving gradually. Weakness can progress into the different sides. Distribution of the weakness in case of DM1, myotonic dystrophy 1, is basically on the face, eyelid, mouth, palate, temporal area, as I told already, nasal, speech, etc., neck, diaphragm, hands, and even with the foot. The distal most areas are most involved. Mostly the distal most areas involved. Okay. Now, in this case, there will be CNS involvement also. Okay, in this case, the CNS involvement is also seen. The problem with the thinking and organizing and planning and attention, that's I told, multiple systems may get involved. But one classical type in the adult onset of myotonic dystrophy, so that is daytime sleepiness. Daytime sleepiness is also quite common. Now coming to the myotonic dystrophy type 2. See, type 1 we have got. In the type 1 also we have got adult onset and congenital onset. Congenital onset again congenital and infant juvenile. And type 1 again we have got adult onset also. Now we are coming to the type 2. Type 2, this is mostly present in the adult, completely present in the adult and not at all in the childhood. See, type 1 can be in children or at birth. Okay, whereas type 2 muscular dystrophy, so this is myotonic dystrophy, this is not like that. Exclusively, mostly seen in adults only. And there will be weakness in the proximal muscles. Okay, as I told, always in type 1, the hallmark of the disease is distal muscles are get affected. Okay, whereas when you come to the type 2, the main characteristic feature is the proximal muscles are affected, as I told in the beginning. So this is mostly present in the adults and not in the childhood. And there will be weakness in the proximal muscles and there will be muscle cramps with pain. And there will be elevated CPK level. Yeah, CPK level. So that part we have never touched, that we will discuss. CPK level will be also because muscle destruction is going on. So CPK level will be also raised. And there will be fatigue, of course. Now, most of the time, it is under-recognized. The congenital cases of the DM2 are not seen. Congenital cases for DM1 is seen. DM2 is myotonic dystrophy is more than a muscle disease. It's not only a muscle disease. We have got multiple problems. Okay, so it is a multi-system disease. The classical symptoms, especially the adult onset myotonic dystrophy type 2, are myotonia and weakness, cardiac involvement, eye involvement, pulmonary involvement, endocrine involvement, and gastrointestinal involvement, hair and skin involvement, immune system involvement, and central nervous system. Especially in the occurs in the adulthood, we have got multiple symptoms. Again, to specify, in the heart, there may be problem related to the rhythm and may develop the weakened heart muscles, cardiomyopathy, etc. When you go to the pulmonary area, muscles of the breathing can weaken, especially during the sleep, and there will be daytime sleepiness, as I told. The sleep disorders, there may be obstructive sleep apneas. Eyes are get affected, maybe cataract may be there. GITs get affected, difficulty in swallowing, etc. Because all the muscles, wherever it is present, everything is involved, including voluntary, involuntary, everything, endocrine, etc. If you look into the genetics of myotonic dystrophy, how do you get the myotonic dystrophy? It runs in the family because it is an autosomal dominant trait. So it will not skip the generation. In each generation, this disease will be there. Each generation is affected, male and female both are get affected, 50%. And this is due to mutation in one gene or maybe a mutation in the piece of the DNA. Especially chromosome number 3. Adult onset is always because of chromosome number 3. Chromosome number 19 is because of the type 1. Okay. So this portion we have already covered. So in the next class, we will go to discuss another important disease related to muscular dystrophy. So that is limb girdle muscular dystrophy. This is also called as ELGMD. And goodbye. Thank you very much. Don't forget to subscribe to my channel. Please